we are getting answers for you this morning about the coronavirus. We have an infectious disease specialist joining us live in studio to answer your most frequently asked questions. All you have to do is post them on NBCLA's Facebook page, include your name and your city. We'll be right back. It's 5:43. We know a lot of you have questions about the coronavirus, and we're getting answers for you this morning. Joining us now is Dr. Suman Radhakrishna, an infectious disease specialist from Dignity Healthcare.
Doctor, thank you so much for joining us. I do want to mention that one of the big questions that we're getting right now is the elderly people with underlying issues. Many want to know if they have elderly parents and they have to take care of them, how should they greet them? What should they do? Lisbeth Aguilera sent us this question right here. We want to get to that. It's a Twitter question. It says, I live with parents that have compromised immune systems. How do I protect them if, God forbid, I contract the virus? That's a question from Lisbeth.
First of all, thank you for having me here. And that is a very valid question because I live with my mom. And the first thing you should be doing, which I do as well, is street clothes. I go home, I change before I greet them, wash my hands, and try not to kiss in the face area. And we've started this thing where we kiss on top of our heads, and wash your hands frequently. And at home, you know, the sink is available, so I don't use the hand sanitizer. When you cook, when you prepare, wash hands. And being close to somebody is good enough. You don't actually have to keep on touching and hugging.
Yeah,
avoid the touching. Okay.
We've seen in some of the nursing homes in the other states, people either FaceTime or they just communicate through a window there.
Yes.
So it's a challenging situation. We have another question from Mary Ellen Welling on Facebook. She's asking, what are the recommendations for folks receiving packages via mail, if any concerned at all? I know that she was concerned about how long would the virus live on certain substances.
Initially, we thought that it was only a couple of hours on inanimate objects, but now they seem to find that the virus can be there for as long as 3 days. And we still don't know much about it. But one thing for sure, touching these inanimate objects and touching your face is the way you introduce the virus to yourself. And so that is the most important thing you have to avoid. If you're touching multiple objects every so often, wash your hands, and if you cannot, then use a hand sanitizer.
A question a lot of people are asking, is it possible that, and I'm curious too, that you can contract, be infected with coronavirus and not be symptomatic and not have those symptoms and possibly not know that you're carrying it?
Yes, about 80% of people who have contracted the coronavirus either have no symptoms or have very mild symptoms. Something like, you know, I think I'm feeling under the weather, but not sick enough feeling. And that's the crux of this whole thing.
That's the biggest threat because people don't know that they have it and
they're going around and walking around and infecting other people. And so two things have to happen. People who are healthy have to protect themselves, which is wash hands. And people who are ill, if you know you're not feeling well and you can take the time off, stay home and until all the symptoms go away. The problem is we are not able to test everybody who wants to be tested right now. And so there may be a lot of people who may slip under that radar.
Yeah, we're going to ask you about the testing coming up in a little while. Dr. Radhakrishna, thank you so much for joining us this morning. You're going to be with us throughout the morning, so we have many more questions for you. We really appreciate you being here.
And if you at home still have questions, you can send them to us. We will ask her in the 6 o'clock hour some of the concerns you may have, and we do want to talk about the test, the concern, and the lack of testing as well. Doctor, thank you for joining us.
Oh, thank you.
Thanks, Doctor. All right, let's joining us now is Dr. Suman Radhakrishna, an infectious disease specialist from Dignity Health, California, and we're here to answer your questions this morning.
Thank you so much for joining us, Doctor. We heard a lot this week about social distancing. How do you do that? What's the proper way to do it? We do have a question from Jenny. Here's a Facebook question. It says, if we practice social distancing, can we still shop? Can we go to the grocery store? Can we go to restaurants?
Good question. And think about social distancing. They're talking about 6 feet. So what's 6 feet? Approximately. It's one arm and your arm, and our arms
so
don't touch each
it
other.
Would be like this. No touching.
Yeah, that's
about this distance.
Yeah, that's approximately 6 feet. I'm of course shorter, but someone who is taller would be you know, a lot more. That's about social distancing. So if there is one person walking in the aisle and another person behind you with 2 cart lengths, that's 6 feet.
Got
Okay.
it.
So you can go to the grocery store. One thing for sure you might want to do is, make sure you're not sneezing, coughing on those tomatoes, because all of us love to pick the tomatoes. We're
Right.
not just going to find the one on top
At the grocery
and
store.
put it in our basket.
Good advice.
Now,
yeah.
more than ever, just have good manners, right?
Yes,
Be
yes.
hygienic. We do have 2 questions from Instagram that go together. One viewer asks, how long does the virus last? And another person asking, if you become infected, can you catch it again?
The first question, how long does virus last on inanimate objects? It can last from several hours to several days. We don't know everything about it, and every day we're getting new information. So what I mentioned today may not be the right thing tomorrow, so everybody has to keep that in mind. So on inanimate objects, if you touch something, then try to wash your hands frequently, get into the habit of washing hands, and don't touch your face, then you're okay.
And can you become reinfected if you're infected one time?
We don't know that yet.
Okay.
What we have found in those instances where we found someone with the coronavirus and we tested them and had 2 consecutive negative tests, a few of them have tested positive afterwards. Are they capable of transmitting infection at that point of time? We don't know those details.
We don't have a lot of time, just a couple of seconds. I want to quickly ask you, because I know we promised our viewers, test. What is the situation with the corona test in California? We don't have enough. There are people walking around that are infected. Is that going to get better at all?
That is our hope, and we hope that by early next week we'll have many more tests, and anyone who feels they may be exposed should be able to get a test. But right now, the doctors are screening and picking the ones who are sick and need the testing in order to do the contact tracing. So today, no, everyone is not able to get the test.
So if you have fever and cough, that's when you should go for sure, right?
When you have fever and cough, call your doctor. If you are otherwise just under the weather but doing okay, they may tell you to just stay at home and not test you.
All right.
Okay.
Thank you, doctor, for being here this morning. We really appreciate it. And so do our
Thank
viewers.
you very much.
Oh, thank you.
From closures.
6:23 right now. We know that a lot of you have questions about the coronavirus, and we are answering them, at least trying to answer as many of them as possible for you this morning.
Joining us now is Dr. Suman Radhakrishna, infectious disease specialist from Dignity Health California. And a lot of people are thinking about age when it comes to coronavirus. On Facebook, Jenny Bethune asks, at what point should the over 60 group be concerned?
The over 60 group is the one that they found had the higher incidence of complications and mortality. And so those are the people. And again, the over 60 group is broken down into people who have no medical problems, or people who have some medical problems, or they have ongoing issues that are not controlled. And the ones who have ongoing issues that are not controlled are the ones who are highest at risk of getting complications. These are the individuals who should call their doctor if they get symptoms. And these are the people we're targeting for testing while we have limited test kits.
Right.
I do want to ask you a question from Letitia Robb from Twitter, asked about testing locations. She's asking, where can we tell people to go if they feel they are showing symptoms for coronavirus?
The best thing to do is don't go anywhere but call your doctor. And they will triage and let you know if you need to go somewhere or just stay at home and monitor symptoms.
All right.
And what about for children? Children, we were talking about this earlier. It seems that not as many of them either are getting tested or are not showing symptoms of coronavirus. What is the reason behind that?
The data is not yet available. So far, so good. Kids are doing fine. Let's keep it that way.
Okay. All right, doctor. Thank you.
So again, but at the point that you need to go to the hospital or check in with your doctor, the fever, that dry cough we were talking about, those are the 2 big symptoms?
Fever, dry cough, shortness of breath. If someone is unable to hydrate, they have a lot of other medical issues, and they're having asthma, which is uncontrolled. These are the individuals who have to call in advance so that the healthcare staff will be ready and prepared. And we want to minimize risk to other individuals who are there and also provide the patient good care.
All this information is so helpful. Thank you, doctor. We appreciate it.
Doctor,
you're
thank you
welcome.
very much. All right.
Thank you.
It is 6:25 right now.
6:44 right now. We know many of you have questions about coronavirus, and we have an infectious disease specialist joining us this morning, Dr. Suman Radhakrishna from Dignity Health California.
Doctor, many parents wondering how to protect their children. We got a question from Linda Ringer Art, and she says her children's school has not been canceled, and so she's asking, is it safe to send our kids to school when so many other areas are already closed, including different companies?
children have done well with this virus so far. And if any mild symptoms, nobody has been sick enough to be admitted to the hospital or, and God forbid, have to, pass away or anything. And I hope it continues that way. So same precautions as you would if your child had a cold or a cough. If they have a fever, keep them at home until symptoms are better. When in doubt, use your judgment, call the pediatrician's office, they'll help you out.
Okay.
And here's a question from Tony Vincent Hale on Twitter. He asks, I keep hearing 6 to 8 feet from people. Does that mean that the virus is airborne? And I think we know the answer to that question, right?
Yes, when someone is ill and they're sneezing and coughing, the droplets spread everywhere, and that's why we're asking them to keep the 6 feet, minimum 6 feet distance from each other.
You guys have been demonstrating that this morning, right?
Yeah.
Like, there we go.
No touching, just like right here. Don't get any closer than that, as much as you want to.
Yeah.
Right? It's just something, and it's temporary. I know a lot of people are stressed about this, but if everyone does their part, doctor, will it make a big difference in the long run?
We have proven that we're citizens of the world because the virus is spreading everywhere. So each one of us has to do our part in order to curtail this.
We did get a message from someone saying they have a trip scheduled to Cancun. Should they go on their trip? Should they not? What should they do? I know it's hard, you can't tell people what to do, but what is your recommendation?
If you can postpone it, we're recommending that you don't want to be in that group situation, then something to think about, but each one has to make that decision.
And one last quick question. Everyone's worried about the tests. Do you know when we're going to see more tests available here in California? Any idea?
We have been told that it'll be starting next week, we would have more tests.
Okay.
This is a new virus. We're still trying to learn it and get information on it. Doctor, thank you so much for easing our minds a little bit, affecting all of us all over the world.
Thank you.
Thank you, doctor.
Yeah, we appreciate you being in here this morning. Thank you.